Why are you home from work so late? It's almost 10 p.m. I'm hungry and thought you were going to make dinner tonight.
You're kidding, right? You couldn't find yourself something to eat? There is no way I am cooking anything right now. Go make yourself a peanut butter and jelly sandwich. I am way too tired. Work was horrible today. I'm so sick of that place.
What now?
We all had to take an extra patient again today. I don't even want to talk about it, you just wouldn't understand.
Why did you all have to take an extra patient today? And what's the big deal anyway?
First of all, we had to take an extra patient today because someone called out and the manager didn't find a replacement, again. And second of all, it is a very big deal and it's the reason I'm getting home so late and you're not getting dinner.
I still don't understand why that's such a big deal. How many patients did you have to take anyway? And I still want something to eat. A steak would be nice.
We all had to take 6 patients again today. They just don't get that more than 5 patients creates a dangerous environment for the patient's safety. I wouldn't expect you to understand, but that one extra patient threw us all over the edge today. It's such an unrealistic workload and like I already said, more importantly, it creates an unsafe environment for all of the patients. Not to mention it threatens all of our licenses. There are tons of articles about nurses whose licenses were jeopardized over mistakes and they had to go under disciplinary review. And of course, with too many patients to care for, mistakes are more likely to happen. I would die if that happened to me. I worked so hard for my license.
What kind of mistakes are you talking about?
Look, all kinds of stuff could happen. I'm not saying that every mistake would be life-threatening to a patient or result in nurses losing their licensure. I read that hospital nurse staffing is a matter of major concern because of the effects it can have on patients' safety and quality of care. Some adverse patient outcomes potentially sensitive to nursing care are urinary tract infections, pneumonia, shock, upper gastrointestinal bleeding, longer hospital stays, pressure ulcers, increased infection rates, skin breakdown, medication errors, inadequate pain management, falls, inadequate preparation for discharge, failure to rescue, and even 30-day mortality.
Mortality?
Yes, death. As a matter of fact, I read in my textbook, when staffing levels or supply is inadequate to accommodate the workload or demands, the impact is significant. It is determined that each additional patient assigned to a nurse resulted a 7% increase in 30-day patient mortality, an increase in 7% in the failure to rescue rate, a 15% increase in the odds of nursing job dissatisfaction, and a 23% in the odds of nurse burnout.
You sound like an encyclopedia. Where are you coming up with all this stuff?
My instructor and my studies have opened my eyes to so much. It never occurred to me that we as nurses have the power and the responsibility to change our own working conditions. I have been doing so much reading in my RN to BSN class and I just can't get all of this stuff out of my head. Not only does inadequate staffing levels place heavy burdens on nursing staff and create adverse events that are painful for patients, but there is also considerable financial cost to be considered. Do you know that just pressure ulcers alone cost $8.5 billion per year?
O.M.G. $8.5 billion per year. That's a lot of steak. How about that steak?
We as nurses have to do something about this.
What does that entail? You guys bearing arms and storming the castle.
Why do you have to be so sarcastic? What I am trying to explain to you is that we could be so powerful if we as nurses learned how to carry one voice and unite as a group. My instructor explained to us something very interesting. We are a very fragmented group of professionals.
What do you mean fragmented? And this one voice thing?
There are millions of registered nurses in the United States and only a small percentage of those nurses belong to professional nursing organizations. And the memberships are spread out among approximately 80 different organizations. So when you look at it in that light, you can see how we have weakened ourselves through this lack of unity on that level.
Well, sure, okay, I see what you're saying, but in general, what do these organizations do for you anyway?
Well, professional associations provide necessary support. They promote the profession, develop standards, communicate news, provide educational programming, honor achievements, and most importantly lobby on behalf of the profession. I guess a good start would be for nurses to join an organization, but the better thing would be for all of the organizations to unite and operate under the same umbrella as one.
Well, that all sounds great, honey. But all that is not going to happen overnight. How about before you take over the world you start making a change at your hospital? Why can't you talk to your manager about these concerns of your understaffing?
We have all gone to her and still nothing has changed. This understaffing has become a matter of routine in that place over the last few months. I thought by now you would be used to me coming home late.
Well, with you staying late and making all that overtime, maybe I will hire us a cook?
Forget about the food already, you're not getting any. I cannot focus on anything, I'm so dissatisfied with my job. And it's not just me. If you go on any nursing forum or do research, you will find evidence about the workload and job dissatisfaction in the nursing profession. The growing nurse workload is causing rising rates of nurse burnouts around the country. Data has also shown that job dissatisfaction is causing many nurses to leave their place of employment.
It sounds like more than any other factor. What is driving good nurses out of practice is intolerable working conditions and the frustration of not being able to deliver safe patient care.
Exactly. That's why I can't wait to get my BSN so I can become a manager and a leader. I aspire to be just like the instructor in my leadership and nursing care management course that I'm taking now. I will support my staff to the best of my ability to prevent job dissatisfaction.
Well, how are you doing that?
My first order of business would be to address this understaffing issue. Not only would I hope to address it at whatever institution that I am working in, but I would like to be able to take it to the state level like California did.
Why? What's so great about California besides the babes?
Well, in California, nurse and patient care ratios are mandated. In 1999, California passed legislation mandating patient-to-nurse ratios for hospitals. The legislation was motivated by an increasing hospital nursing shortage and the perception that lower nurse retention in hospital practice was related to burdensome workloads and high levels of job-related burnout and job dissatisfaction. We can get this same legislation passed in our state and better yet, maybe someday nationwide. I know this can happen. I'm going to be a part of this change. I'm so happy to be getting my BSN so I can have a positive impact for the future of nursing. Oh darling, thank you so much for letting me vent. I feel so much better than I did when I walked in the door. Let's go make you a steak.
Excellent.